We're now going to look at what is expected of you and the support that is available from now until the beginning of the trial in April and for the 2-year period from April onwards. So local authorities have a number of roles and responsibilities arising. And clearly, the first is that local authorities must notify parents and young people about these extended powers when they make the decisions listed in this slide. So pretty much all decisions around SEN under the Children and Families Act, apart from the decision not to assess. So in all of these instances, letters and information to parents notifying them of decisions must include information about the tribunal's extended powers. Local authorities must also include the extended right of appeal in their local offers, so the local offer must carry information about this new right of appeal. Local authorities must provide evidence to the tribunal from the health and social care bodies in response to issues raised, and they must do so within the time frame specified by the tribunal. Where necessary, local authorities are able to seek permission from the tribunal to bring additional witnesses to any hearing. And local authorities, for the period of the trial, must send the Health and Commissioner's response to any recommendations arising to the evaluation team within 1 week, as long as the parent or the young person has not opted out. So this does involve quite a bit of preparation for local authority SEN teams, and we do expect local authorities to update local systems, their policies, their various procedures. Importantly, these must include the decision letters so that it is clear what the new right of appeal is. They must update the local offer before the 3rd of April, and we expect that to include co-produced information on the trial. It's really important that IASS are able to provide parents and young people with information and guidance about the new rights. There's also a role to play in training staff and disseminating key information and guidance about the new procedures. It's really critical, of course, that our local CCGs and our children and adult social care leaders are fully aware of the trial. This is clearly a shared responsibility, but also local authorities need to make sure that it has happened. And also it's very important that local authorities know who the lead contacts are for dealing with appeals, both in CCGs, in the children's social care teams, and in the adult social care services. There are also a number of roles and responsibilities for health and social care commissioners, and these include that they must respond to any request for information and evidence within the time frame set by the tribunal. Where they're required to do so, health and/or social care must send a representative to attend any hearing to give oral evidence. And also, both bodies must respond in writing within 5 weeks following a recommendation to the parent or young person and the local authority, setting out the steps they will take or why they will not follow the recommendation. So health commissioners will need to prepare for the trial, and this includes all CCGs and all health commissioning bodies. So there is a need for the CCGs to work together with their specialised commissioning colleagues. Health commissioners need to update their local systems, policies, procedures, etc. And they need to include drafting responses to recommendation letters that may arise from hearings or judgments. They need to train key staff and disseminate key information and guidance to those involved in the process, and also consider whether the local processes do ensure that there is a clear communication system, and Also, gain an understanding of any previous learning points around complaints or tribunals. Similarly, social care commissioners have roles and responsibilities which are not dissimilar to those for health. So they do need to make sure that both adult and children's social care services are fully informed and prepared. And they too need to update their local systems, policies and procedures to ensure that they are able to respond to recommendation letters, that their staff have been trained, and that local processes have good, clear communication systems. We have put together a support package which includes the following elements. Firstly, there has already been delivered across the country a set of regional induction events in January and February for all local areas. We are putting together a guidance document for education, health and social care professionals and for parents and young people. There will be a toolkit for local authorities with templates and FAQs. There will also be ongoing support through a help desk, newsletters, this webinar, DFE SEND advisors, and NHS England advisors. Information advice and support services and voluntary sector organisations, we are also expecting to provide support to families through, for example, disseminating information on the trial, supporting the preparation of cases and at hearings, and also signposting to mediation and other forms of further support. There will be some support funding for local authorities. Local authorities and CCGs can be reimbursed for reasonable costs incurred during the trial. So for every case, there will be a grant of up to £4,000, which will be awarded to local authorities. This is likely to include tasks such as informing the costs of informing social care and health colleagues of the appeal, collecting evidence from them to send to the tribunal, the costs around possible attendance at a hearing, and payment to social care and health colleagues in relation to the gathering of evidence, creating the case argument, and any costs associated with responding to recommendations. It will be local authorities who submit a quarterly claim, and they will do so to Mott MacDonald, and it will be the responsibility of the local authority to transfer any funding claimed by their health commissioners to the health commissioners. There will also be an independent evaluation team, and they will be doing a number of activities throughout the course of the trial. These include an online and telephone survey of parents and young people. We're expecting in-depth case studies in 12 local areas. There will also be an annual online survey of all local authorities and all CCGs. They will also be doing an analysis of the responses to recommendation letters. So there will be 12 case study areas who will receive visits in March and April 2018, then in June 2019 and June 2020. Those visits in those 12 areas will include interviews with a wide range of key stakeholders, including family support organisations. These 12 case study areas will also have an additional opportunity to feed into the development of the trial. The case study areas have yet to be selected, but there will be a number of benefits of being involved, including receiving their own individual case study report. They will be showcased in good practice guide, and it will also raise the profile of the trial in your local area. In addition, all local areas and CCGs will have the opportunity to participate through an online commissioner's survey. This will be short, easy to complete, and there will be two of them, one in the summer 2019 and another in the summer of 2020. There will also be sense checking of the cost data. So we do want to get a full understanding of the costs, and that will be through one-to-one discussions with the evaluation team. The evaluation will also raise awareness amongst colleagues, and we also want contact details for the online survey. An important element of the support available will be the toolkit, which will be issued in late February. This will include a summary of the national trial, both for local authorities and CCGs, and also one for parents and young people. There's also going to be varied sample wordings for local areas to use. One will be wording to include on local offers. Another will be wording around key decision letters around the SEN process, and also a sample letter for drafting responses to recommendations arising from hearings and judgments. There will be guidance around the national trial. This includes a summary of the requirements and expectations on local authorities, health and social care commissioners, a description of the tribunal's appeal process. There'll also be a list of the support available to local authorities, health and social care commissioners. It will also provide information about other routes of complaint and redress. There will also be a section describing the implications of not following recommendations. And finally, there will be a description of the role of the research and evaluation team. And finally, support during the trial. Mott MacDonald will be able to take ongoing queries around the operation of the trial, and you can see there the email address to contact. All local authorities have a Link SEN advisor from the department, and that advisor will be there to provide second opinions to you on your draft local authority documentation, for example, your letters, local offer information, or other information leaflets. During the course of the trial, the advisor will be there as a source of ongoing contact for you over any queries arising, and the advisor will act as a conduit for information exchange and problem solving between the local authority and the DfE. Similarly, advisors from NHS England will be available to support the trial and will be the main contact for health queries, as well as acting as a conduit for information exchange to the Department of Health.